Imagine walking into a hospital and hearing everyone speaking a language you don't understand. Confusing, right? This is a common experience for many people who are unfamiliar with the intricacies of medical terminology and procedures. That's what it's like trying to navigate the world of healthcare without understanding medical coding. Medical coding is a specialized skill that requires extensive training and knowledge. Medical coding is like a secret language that healthcare professionals use to communicate. It ensures that every diagnosis, treatment, and procedure is accurately recorded and understood by all members of the healthcare team. It's how we translate medical diagnoses, procedures, and equipment into standardized codes. These codes are universally recognized, making it easier for healthcare providers to share and understand patient information. These codes are essential for everything from billing insurance companies to tracking patient outcomes and conducting research. They play a crucial role in the financial and operational aspects of healthcare. Without accurate medical coding, hospitals and clinics would struggle to get reimbursed for their services. This could lead to financial difficulties and impact the overall efficiency of healthcare facilities. This could impact their ability to provide quality care to patients. Accurate coding ensures that healthcare providers are fairly compensated, allowing them to continue offering essential services. So, you see, medical coding is more than just numbers and letters. It's a critical component that supports the entire healthcare system. It helps maintain the integrity and accuracy of patient records. It's the backbone of our healthcare system, ensuring that every aspect of patient care is documented, understood, and properly managed. Without it, the healthcare system would be chaotic and inefficient. In the United States, we use a system called ICD-10 PCS for Inpatient Medical Coding. ICD-10 PCS stands for International Classification of Diseases. 10th Revision, Procedure Coding System. Don't let the long name scare you. It's just a fancy way of saying it's a system for classifying and coding medical procedures performed in hospitals. ICD-10 PCS is a 7-character code system. This means each procedure, from a simple blood draw to a complex surgery, is represented by a unique 7-character code. This level of detail is crucial for accurate billing and data analysis. It allows healthcare providers to communicate clearly and efficiently about the care they provide. The ICD-10 PCS codebook is like a map that guides medical coders through the world of procedures. It's organized into 17 chapters, each focusing on a different section of the body or type of procedure. For example, Chapter 0 covers medical and surgical procedures on the nervous system, while Chapter 3 focuses on the heart and great vessels. Each chapter is then further divided into sections, subsections, and finally, individual codes. Knowing how to navigate these chapters is essential for finding the right code for each procedure. It's like solving a puzzle, but instead of colorful pieces, we use letters and numbers to create a complete picture of a patient's hospital stay. Now let's walk through the process of coding an inpatient chart. This is a crucial task that ensures accurate billing and proper patient care. Coding an inpatient chart involves several detailed steps, each requiring precision and a thorough understanding of medical documentation. The first step is to thoroughly review the patient's medical record. This comprehensive review is essential to capture all relevant information. It includes understanding the patient's history, the reason for their admission, and the treatments they received during their stay. This includes the physician's notes, operative reports, and any other documentation related to the procedures performed. These documents provide a detailed account of the patient's journey and are critical for accurate coding. Next, we identify all the procedures that need to be coded. This step involves carefully examining the medical records to pinpoint every procedure, no matter how minor, that was performed during the patient's stay. This requires a good understanding of medical terminology and the procedures themselves. Medical coders must be familiar with a wide range of medical terms and procedures to ensure they can accurately identify and code each one. Using the ICD-10 PCS codebook, we look up the appropriate code for each procedure. The ICD-10 PCS is a comprehensive coding system that provides specific codes for a vast array of medical procedures, ensuring standardized documentation. This involves selecting the correct codes for the body system, route operation, approach, device, and other qualifiers. Each code must be meticulously chosen to reflect the exact nature of the procedure performed. Finally, we double-check our work to ensure the codes are accurate and complete. This step is crucial to avoid any errors that could lead to incorrect billing or affect patient care. Once we're confident in our coding, we assign the codes to the patient's record. This final step ensures that the patient's medical history is accurately documented and that the healthcare facility can bill for the services provided. Section 5. Case Study, Deciphering a Medical Mystery. Let's say a patient is admitted to the hospital with appendicitis. This condition, characterized by inflammation of the appendix, often presents with severe abdominal pain, nausea, and fever. Immediate medical attention is crucial to prevent complications such as a ruptured appendix, which can lead to peritonitis, a life-threatening infection. The surgeon performs a laparoscopic appendectomy, removing the appendix through a small incision in the abdomen. This minimally invasive procedure involves the use of a laparoscope, a thin tube with a camera and light, allowing the surgeon to see inside the abdomen and guide the surgical instruments. How would we code this? Medical coding is a critical process in healthcare, translating medical procedures into standardized codes for billing and record-keeping. Accurate coding ensures proper documentation and reimbursement for the healthcare services provided. First, we identify the body system, digestive system. Chapter 2. The appendix is part of the digestive system, so we start by locating the relevant section in the coding manual. Then, we determine the root operation, excision, which is the removal of a portion or all of a body part. In this case, the appendix is being removed, so excision is the appropriate root operation. We also need to specify the approach, percutaneous endoscopic, using a scope inserted through a small incision. This approach minimizes recovery time and reduces the risk of complications compared to open surgery. Finally, we need to include any devices used, in this case, a laparoscope. The laparoscope is essential for visualizing the surgical area and performing the procedure with precision. Putting it all together, the code for a laparoscopic appendectomy would be 0DTJ4ZZ. This code encapsulates the body system, root operation approach, and any devices used, ensuring comprehensive documentation of the procedure. Section 6. Inpatient versus outpatient, coding spotting the difference. While ICD-10 PCS is used for inpatient coding, outpatient procedures are coded using a different system called ICD-10-CM, which stands for Clinical Modification. The main difference between inpatient and outpatient coding lies in the complexity and setting of the medical services provided. Inpatient coding involves procedures performed in hospitals where patients stay overnight, while outpatient coding covers procedures performed in outpatient settings like doctors' offices and clinics. Generally, inpatient coding involves more complex procedures and requires a higher level of detail compared to outpatient coding. Section 7. The high stakes of coding accuracy matters. Accurate medical coding is crucial for a number of reasons. First and foremost, it ensures that hospitals and healthcare providers receive the correct reimbursement from insurance companies for the services they provide. Inaccurate coding can lead to claim denials, delayed payments, and even financial losses for healthcare facilities. Moreover, accurate coding is essential for tracking patient outcomes, conducting research, and identifying public health trends. When codes are assigned correctly, researchers can study data, identify patterns, and develop better treatments and prevention strategies. Section 8. Staying ahead of the curve. Resources for success. Mastering inpatient medical coding requires ongoing education and a commitment to staying updated with the latest coding guidelines and regulations. The American Health Information Management Association, or AHIMA, and the American Academy of Professional Coders, known as AAPC, are excellent resources for medical coders. These organizations offer certification programs, continuing education courses, and access to valuable resources such as coding manuals and online forums. Additionally, staying informed about changes in healthcare policies and regulations is essential for maintaining coding accuracy and compliance. Section 9. Mastering the code, mastering healthcare. Inpatient medical coding is like a puzzle, and like any puzzle, it takes time, practice, and the right tools to master. But the rewards are well worth the effort. By understanding the intricacies of ICD-10 PCS and developing strong coding skills, we contribute to the efficient functioning of our healthcare system. We ensure accurate billing, support research efforts, and ultimately, contribute to improved patient care. So let's continue to learn, grow, and strive for excellence in the ever-evolving world of medical coding.